All right. Hello and welcome, everyone. We are going to go over the butcher broom. Sounds like something we're just going to sweep off the table, but that's where it actually came from. That is what it was talking about, right? Was the butcher broom. So when we go into this, people say, well, why are you doing this anyway? What does it matter? Well, I believe the Essenes and others had multiple knowledge. I believe when we limit ourselves to just one thing, then that's the knowledge that we have. That's all that we can contend with, right? But when we go with the knowledge of the ancients, when we go the knowledge of what Yahweh has given us, then how can we go wrong? How can we have too much knowledge? If we know knowledge is power, if we know the scriptures that says my people are destroyed for a lack of knowledge, then we should have all the knowledge that we could possibly get a hold of. So with all that being said, the potential benefits, butcher's broom and its compounds are associated with several potential health benefits. Inflammation in your body is its natural way to heal itself and combat infections. However, chronic inflammation can cause health problems as it increases your risk of certain diseases. So we all seen football players have their knee hurt or have something go wrong or their elbow in baseball. And, if they don't deal with it down the road, they have to have surgery. We have a neighbor and his knees, he knew they was bad, but what do you do about it? A lot of people don't know, well, we eat bananas and apple. That's all we know to do. But when we know there's actually herbs out here, and I believe, honestly, this should be taught in assembly, not on the Sabbath, not on, maybe even the first day. But what's wrong with a Wednesday night? What's wrong with a Thursday night? What's wrong with getting together and learning and teaching even the children these things? I don't see how it could be a bad thing instead of getting together and teaching them worse things, right? So, for instance, in test tubes, the studies of the broom, the butcher's broom, the Rheucus autochaetus, if that's correctly, for all those botanical people out there that know this, it contains compounds that reduce that inflammation. And in studies, this is not just something we're talking about. This is studies that people have done, and it is proven. See, that's where we really don't worry about science. We don't worry about facts. We're worried about theories. We're worried about nonsense. We're worried about non-facts, right? Non-factual things. We're not scared of something that you can test and it works. We should never be afraid of that. We should never be afraid of just like this. We test it. We see 20 people take it. 20 people got better overall. 20 people took it. 19 got better. So we shouldn't be afraid of the facts of the situation. It's when the facts don't add up, right? It's when we make up stories and things that are not true. That's the problem. And the same thing with the scriptures. We don't add to or take away. We don't make it fit so I can be the next YouTuber. We don't do things like that. We give what it says. And if you have the knowledge, the Ruach, for any further, that's why we have Midrash, right? That's why we talk about the things. But there's nothing I believe wrong with making yourself healthier, with combating probably what we've been eating and doing and partaking in for way too many years, right? All the garbage and all the chips and ice cream and all that junk we've been shoveling in, and then it causes inflammation, it causes problems. Then we have a problem, and other than going to a doctor, what do we do? What do I do about it? What is the average person? What can they do? Well, most people don't know. So as we see here, it is, we'll go back over here. In test tube studies, it has reduced inflammation markers and stopped the production of the enzyme, which promotes cartilage breakdown in people with osteoporosis. So some of these elderly people that have these problems, it would help them. You see people that are bent over and they're hunched over. And, they didn't do it that way. They didn't plan on being that way. But what happened is what happened, right? They can't help what happened to their body, but maybe they can. That makes sense. Maybe if they do the right thing, they can help what happened to their body. Maybe they can stop these things from happening. So an animal study, it reduced inflammation markers associated with diabetes and treated damage caused by such inflammation. So this is what it looks like here. It almost looks like a type of cherry, right? If you're on Facebook, I don't know why we can't get Facebook and YouTube at the same time, but for some reason right now it's only letting me have YouTube Live. So you should see it on the YouTube, but on the Facebook, I guess I'll just have to put on there later. So nested in parts of Europe and the Mediterranean lives a plant that looks like first glance like a disappropriate holly bush, but which packs some great circulatory benefits. Talking about the butcher's broom, the small evergreen bush used historically as a remedy for a large number of problems, including osteoporosis, gallstones, varicose veins, and hemorrhoids. That's right. All those veins that you see the older people getting in their legs and their feet and their ankles, who would have thought? So today's butcher broom is known most widely for the way it benefits from the circulatory system, especially those with orthostatic hypertension, a drop in blood pressure when going from sitting to standing, and chronic venous insufficiency. So you ever know somebody that stands up and they feel like they're going to faint? This is the help for that. You know, I mean, we live with things because we have to, honestly. But if we know there's something out there, if we know that this can help that, then why wouldn't we try it? Most of us, we don't know. You know, when I was raised up, you took aspirin, you took Tylenol, you went to the doctor. Other than calamine lotion and alcohol and a Band-Aid, what else did you do? Well, you put some Band-Aid on it, maybe some ice. That's all we knew to do, right? In most cases. Now, some people might have a medical background or something like that, but, you know, for the most case, I believe a lot of us just have that, slap a Band-Aid on it, you know, get you some good old chewing tobacco and spit it on it. I mean, that's the home remedies, right? Right? Somebody are like, what? But that's what they did. They would take that chaw tobacco and put it on something that's drawed it out. Did it work? Was it okay? Who knows? But the whole thing and the point is we should have known these things and we should learn these things. I believe somebody in the household should know it, right? So it is a member of the lily family. A plant also has a lot in common with the asparagus plant. Typically, the young stems and roots are used to create supplements. In some cultures, the shoots are prepared and eaten similarly to asparagus, although the flavor is much more bitter, right? The plant is also known by a number of other names, including box, holly, pedigree, sweet broom, Jew's myrtle, and knee holly. Imagine that. Why would they put that in there? As I mentioned, the folk uses of this plant are many in various forms. Butcher broom has been used as a laxative, a diuretic, a circulatory booster. Although there are no studies yet back to many of these benefits, it is still recommended by many natural health practitioners to treat hardening of the arteries, swelling, Raynaud's disease, gallstones, varicose veins, and hemorrhoids. So we have right here something that would help various different things. And instead of going to doctors and paying, and they just want you to keep coming back, why not try something that maybe work? And the whole point of these was to get rid of the problem. The whole point of taking these is not to take it forever. These are to fix the problem or cure the problem. And in the studies that they've done, 19 out of 20 people with varicose veins, in 4 to 8 weeks, they was gone. Not it kind of helped, it kind of did something. it was gone in 19 out of 20 people. That's pretty good. Now, again, by all things, we have to put it on there, consult your doctor, let your doctor know, get a hold of this, do that, and make sure you know what you're doing, right? And we have to put that on because we have to. That way, I can't say, well, I got a PhD in this, and this is just helpful information. You know, you can go on the internet and you can buy it just like anybody else. You can get it in countries or wherever. And the biggest thing what I found though is the powders. The powders, I believe, are far superior. And again, my opinion, not a PhD. So if you go to your doctor and he says your temperature is better or whatever, or you think it is, you know, this is where we add prayer. This is where we add common sense, right? This is where we add in what we are to do. This is an informational video. Is to let you know this exists. It's out there. If you would care to use it, if you have someone sick, ill that has any of these problems, then by all means, do some research and find it out. Again, I don't sell it. I don't get anything out of it. The only thing I get out of it is you may be better. You may feel better. And if you do use it or you try it or you find out and went to your doctor, whatever you do, and you come back feeling better, or you have these things removed, or you have someone who has hardening of the arteries and they're not so bad off, then please let us know. Of these, the majority of the reports finds Butcher Broom might be effective for swelling and hemorrhoids. This is possibly due to the anti-inflammatory compounds found in Butcher's Broom roots, which specifically cause contraction of veins. So again, it makes your veins go down. But what does the science say? It treats the veins insufficiently. Some called post-traumatic syndrome and related to Belvius and other causes. Chronic venous insufficiency is a circulation problem in which your veins, usually in the legs, but sometimes the arms, have non-functioning valves, causing blood to pool in your limbs and internal pressure to rise in the vein. Women, especially those who have been pregnant multiple times, middle-aged and older adults, are the greatest risk for developing the chronic vein, the CVI, insufficiency. Actually, this condition is quite common, possible affecting close to 40% of the population of the U.S. Risk factors for developing the CVI include varicose veins and deep vein thrombus, which is a blood clot, right? If you start having something happen, then sometimes you get a blood clot, or you're told you got a blood clot. But how do we really know? But if we use the right things instead of other things, this can help as well. But again, if you have a blood clot, if you think you have a blood clot, you need to go to the emergency room. You need to go somewhere. You need to get it checked out, right? This is not Dr. Greggy's hour. This is information. Why this condition is rarely life-threatening, it can be tricky to treat. Conventional medicine generally suggests compression treatment, and patients don't seem to like that much because it's pretty uncomfortable. However, the treatment includes Butcher's Broom as well as horse chestnut seed extract. Both of these have been shown impressive results in studies where they were tested. Now, again, the thing that we don't know about is because when you go to the doctor, they don't give you this, right? When you go home, you don't take this. So we have to understand and put a little bit of the common sense factor in there. If you're not sent home with this, then of course it didn't help you because you never took it, right? That's where they claim this helps, that helps, this helps, and that helps because they actually took it. But you have to understand the scales of the matter. So it is heralded by many researchers as an effective natural treatment for chronic venous insufficiency with minimal to no side effects. It is believed that the presence of saponins and compound escalin contribute to Butcher's Broom pro-circulation benefits, particularly those seen when treating the CVI. which was the big blood clot, right? So changes in blood pressure when standing are common in older adults and result from the body's poor circulation. That's just, they're fancy words for saying that, but that's what it really means. It's you stand up, and because your head and everything gets up, your heart has a time forcing that blood, so you get lightheaded. They feel like wobbly until they catch themselves, and then they go on. Most of them will tell you there ain't nothing to do for it, or is their blood pressure, or this, or most doctors just say, well, you're old, deal with it. And most old people say, well, it's just a part of getting old. But we see in scriptures, people in their 80s, 86, 80s, ready for war is what they proclaimed, right? So I don't think they was getting up and flopping on their face. That's not ready for war. Ready for war means you got to get up and be ready for war. You're ready to fight. Hold on, give me a minute. Let me get my bearings. Where's my sword? Where's my sling? Okay, now I'm ready. Let's go. When you stand up, blood moves to the pools in different places within your body as your circulatory system functions naturally, adjusting for the change in posture to keep blood pressure consistent. So the orthostatic hypotension occurs when your body stops doing this properly. Diagnosis of this condition often involves tilt table testing at your doctor's office. But I think, again, you have to be tested if you think so. But in most cases, most people can understand if they're standing up and this is happening, or it's happening to your parents or grandma or grandpa, you probably know what's going on, right? The first line of defense, even according to conventional medicine, is to begin by eliminating any prescriptions that might be causing this problem. Doctors sometimes prescribe getting more sodium in the diet and minimizing the high carb rate foods to manage the condition. There are also medications prescribed to treat the condition. A 2000 review of studies involving treatment for chronic orthostatic hypertension discovered that drug therapies used to treat this are only marginal, useful, and overall disappointing. Wouldn't that be great to spend 6 months or a year to find out it really didn't do nothing? The whole time you're doing it, you still are feeling lightheaded when you stand up. On the other hand, supplication with butcher's broom is safe, inexpensive, and has been extremely promising in all related research. Again, facts do not scare us. We like facts. We like, facts. If 100 people have been tested and 99 had helped, that's a pretty good percentage. If 1,000 people have been tested and 950 have helped, that's a pretty good percentage. These are facts. These are things that we're not afraid of. It's when we say things that are not facts, they're theories, and we proclaim them to be facts. When stone tablets and things say it's completely different, then we have a problem. In fact, author of the review points out the butcher's broom has two features that no conventional drug treatment for this condition has. It doesn't cause supine hypertension, a common condition that occurs alongside with the orthostatic hypertension, in which blood pressure rises rapidly while lying on the back. So you lie down and the blood pressure, because you're lying down, goes rapidly. And it alleviates symptoms even in hot environments. Because what happens when it's hot? Your blood gets thinner, right? And that's another fact. When it gets hot, when you're in a hotter environment, your blood will look almost like water. And even the tone, the texture, the color of it will even look like a lighter, almost like a watery red blood. While these results need to be reproduced on the wider scale of medical research, it seems that the butcher's broom might be a relative safe and effective treatment for method of people with chronic orthostatic hypertension. So, how did we get such a name? In Europe, butcher's block would bind the stiff branches together to sweep and clean the cutting blocks. That's what they would do with it. They would take it and use it to sweep off the cutting blocks. That's why it's called Butcher's Bloom, aka box holly, pedigree, sweet broom, the sweet broom, right? Hand me the sweet broom. Jew's myrtle and knee holly, member of the lily family. It grows to about 3 feet high, has flat leafy branches, large red berries, and a greenish white flower from late winter through spring. So we know what we're looking at. You can plant this stuff yourself, or if you're going into certain places, if you're looking for it, you can find it. Where can I find it, you ask? Found natively in the Mediterranean, Iran, Azores, islands, and parts of Africa. It has been a common European folk remedy for 2,000 years. A lot of this stuff is not new. It might be new to us because we've never heard of it. It might be new to you because you've never heard of it again. But that doesn't make it new. It just makes it new to you, right? It's just like the Sabbath or scriptures or something like that, that it might be new to you, but for some reason, people think this is a new religion. It's a new thing, when this is the way it was from the beginning. The Sabbath day has always been the Sabbath day, right? People make things too hard and try to dig into things that they don't have to. The week has 7 days. We count them out. We sing songs about it. It's that simple. Same thing with this. You try it. If you have these problems, if you know somebody has these problems, you try it. You start out gently, easily, and work your way from there. Benefits. While Butcher's Broom has been used in folk medicine for centuries to treat a variety of ailments, current medical research has only clinically proven treatment for 2 conditions. Now, just like with anything else, you know, the people are going to say it doesn't work, it's junk, all this stuff, because they don't want you to go and buy a bag of this for $20 and you can go buy a bag of pills for $100. And this again might work for 4 to 8 weeks. You might use one bag and they might keep you going for 6 years. So we have to, again, stay with the facts, stay with what works. And if it doesn't work for you, it doesn't work for you. But if you want to try it, again, informational. Chronic veins and orthostatic hypertension. Precautions. They look lovely, don't they? Could you imagine if we all had gardens like this with all these things in it? We could just go pluck them down, need them ourselves. May interact with blood pressure and stimulant medications. Speak with your doctor or naturopath first before taking Butcher's Broom supplements. May interfere with digestion. Little is known for certain Butcher's Broom effects during pregnancy and nursing. To be safe, avoid using it if you are pregnant or breastfeeding. The history and interesting facts. The Butcher's Broom shrub grows to about 3 feet high with flat leafy branches, large red berries, and a greenish-white flower from late winter through the spring. It is found natively in the Mediterranean, Iran, the Azores Islands, and parts of Africa. How did it get such a name? Because of how the stiff branches are used. We went over that already, that they used it to sweep the clean cutting blocks, to clean them off. In folk medicine, Butcher's Broom has been a common part of European remedies for 2 millennia as a laxative and diuretic. It also, in some cultures, it soaked the roots in wine or water and then drank it to get rid of stomach pain. So it's another multi thing that I would suggest, again, that you look into, that you investigate, that you do some more researching, especially if you're going to take it. If you're just going to inform your buddy, your friend, or an elderly person, that you let them know, but you also do research and find out. It was used to treat kidney stones as far back as the 1st century AD. So the way I look at this as well is taking from the ancestors and finding out what the ancestors say, what the ancestors was using because they didn't go to the doctor. They didn't have the hospital. They didn't have the things that we have. So maybe they use these things because they worked for 2,000 years. If something don't work, we can all get together and say that's garbage. It's not that good for me. But if it works, why not try it, right? English herbalist Nicholas Culpeper prescribed butcher's broom to heal fractured bones, taken both orally and made into a poultice over the break. So they would actually take this orally and then put it on the bone or over the skin of the break of the bone. So obviously there's a little bit more than what meets the eye, right? No, it's not a transformer, but it is more than meets the eye. How to use the butcher's broom. There are a number of ways to get the benefits of butcher's broom. Many people take it as a supplement form, which can be found in peels, oils, and creams. As mentioned earlier, some people eat butcher broom roots like they would asparagus, although it smells and tastes much more pungent and bitter than asparagus. So it's got a bitter taste to it. But again, you're not taking it for the sweet cherry taste. You're not taking it because it tastes like cherry pie. You're taking it because it is something to prevent or possibly heal the problems that you have. There are a couple of issues to be aware of if you choose to take or eat the butcher's broom. For one, it contains cannabinoids. These compounds are something of a mystery because they have incredible benefits on one hand and potentially major drawbacks on the other. For example, cannabinoids might interfere with digestion and cause issues when ingested, which is why they're on my list of anti-nutrients to avoid. However, and this is theirs, not mine. However, these are some of the same compounds that benefit the circulatory system. So again, it all depends on you and your body in a way, because we see some people take it for hemorrhoids, some people take it for a stomach ache, some people take it and they're saying they get a stomach ache. So I would submit that it's probably how much you take, and with this or anything else, you don't grab a shovelful and think it's candy and just take a wild throw and stab at it, that you actually go with the instructions are a little bit less than the instructions. The instructions are 500 megagrams, about 1/5 teaspoon, 3 times a day. So again, you're not taking a teaspoon 3 times a day. You're taking 1/5 of a teaspoon 3 times a day. And I would drop that down to just take the third of it or a little bit of it and see how your body reacts. You should know if you get sick, if you start feeling funny, if any of that happens, then you obviously know not to do that, right? But if you don't, and there's no adverse reactions, you don't have a stomach ache, you didn't get a run to the bathroom, again, this is not something that we're taking just to see. The whole reason for these videos is to help people who have deep veins, blood clots, problems that's been recurring or occurring or happening for years, and in some cases for the elderly that stand up and about fall down or stand up and fall over, right? So, and do I take it personal? Yeah, because my dad takes pills and he stood up one day and fell on his face, and he can't understand why he fell on his face. And no matter how much you tell him, it was probably the 9 to 11 pills you throw in your hand and take that. So you see where I'm coming from. We have to think about things. We have to be informed. And please, if you're taking pills, then yes, you need to get a doctor. You need to get something that confirms, because as we've seen, you don't want to take blood pressure pills and this. It would probably throw you in the floor. Your blood pressure may fall out and you may fall on the floor, which goes to kidney failure, which goes to respiratory. So please, again, I'm not a doctor in this. I'm not a herbalist, if you will, or any, certificate on these things. I am just information passing on what this may help you or your family, or just general knowledge. You know, there's nothing wrong with having knowledge. We can watch 30 minutes of YouTube people falling on their face and fall off a skateboard and ridiculousness for an hour or 2 or 5. So why can't we have some information? Why can't we know? Maybe somebody someday will say, hey, Granny fell off the couch when she got up and skinned up her face. Well, hey, I've heard of something. What was that? Oh yeah, that broom stuff. What, butcher's broom? Yeah, butcher's broom. Right? At least one report has recorded an incident of a woman with diabetes developing ketoacidosis, a potentially fatal complication for diabetic patients after using butcher's broom. So again, you have to be careful with all this stuff. One major concern doctors have about the butcher's broom is the number of conditions it used to treat without the support of proper scientific research. In particular, hemorrhoids pose a significant medical concern, and at least one review finds it concerning that butcher's broom might not be used this condition because it can result in lost time with no results and a potential worsened issue. So again, just like with anything else, you have to see if it works, consult your doctor, your physician, and know what's happening, right? In addition, it is possible that butcher broom may interact with blood pressure medications, just like I said, and stimulant medications. So if you're taking either of these, you should probably avoid butcher's broom. Butcher's broom is a plant used to create supplements that is found in parts of Europe and Africa. Traditionally, it's been used to treat a number of conditions from gallstones to hemorrhoids. The two conditions that seem to be affected positively by the butcher's broom are orthostatic hypertension and chronic venous insufficiency. Butcher's broom may interact with blood pressure and stimulate medications. So do not take these together unless explicitly instructed by your physician. Must have been written by a physician. Explicitly instructed by your doctor, PhD. Anyway, detox your liver, a 6-step liver cleanse. L-glutamine, benefits of a leaky gut metabolism. Fast and easy. I should say festival recipes, right? We should be doing this for Sukkot and Passover and possibly trumpets. Woo-hoo. 9 proven black seed oil benefits that boost your health. And what about Wonder Bread and the Ezekiel diet? So again, we are going to leave this in your hands, and we are going to tell you and inform you of what and why, how come, right? So with all that being said, is there any questions on the YouTube or anybody need to? You know, again, a lot of this is just straight letting you know the information that there's all kinds of people that are sick and having problems and having all kinds of things going on in their life. And this is something that you may be sitting around wondering, praying, hoping there was something you could do that might help it, something that might cure it, something that might help your situation. So again, we have to be wise about it. If you're going to take something, then make sure you know what you're taking, know the risk that you're taking, and by all means, you know, don't just gobble it down. There's so many people that don't think the herbal is, or the herbs, however you want to say it, is a really medication. But they thought so for all these thousands of years, and they took it to do these things. So we don't want to just take them, and you don't want to just take them, please, and try it for something to do. You know, you're bored, you ain't got nothing to do until the first of their year, so you want to do something. Well, play ping pong, you know, do something else. Read your Bible, but don't do things just to do them. Now, again, if you have problems, then this is what this is for. It's an information video to help you, that I believe that as Bible believers, as scriptural believers, we should not only learn the scriptures, but it also says in the scriptures, physician, heal thyself. It talks about the herbs, the anise, the mint. It talks about the balm of Gilead. Is there no balm in Gilead? So there is healing, and there is things in other ways than just saying, I pray, and that's that. If we had the knowledge, I mean, what do you do when you scratch? Do you pray for that scratch, or do you go and put some salve and a Band-Aid on it? You scratched yourself, so you didn't want to scratch yourself, but it happened. So the best thing you can do is put the best thing that will help it heal on it and cover it up so it don't get infected, keep it clean, and go on with your life and let what Yahweh gave you and how he made you heal yourself. But the more deeper the wound, the wider the wound, the more that you might need something to fix it. And eventually, if it's too big, too deep, cut a vein or artery, you need immediate attention, right? So, but all that goes into, I believe, a truth believer, a person who's just, we're not made to be sick. He didn't make us as ailments. He don't want us to be sick. He says, I have plans for you. He wants us to have sound minds and bodies. And that's exactly what it says. We don't need to add to, take away, and turn into Superman and Wonder Woman and all that. We just have to take what he said. He wants us to be prosperous. He wants us to have sound minds and bodies and to be healthy. That way we can help everyone, right? So, any questions, comments? If not, we're going to close it down. And again, if you have any questions, and you would talk about this later, you want to talk about this offline, or you want to send a comment, that's fine. That, again, this is all about information. And what I plan on doing is taking some more and having some more. And yes, there it is. That's what it is. You can take it, open it up, take a little bit of it. Like it says, a little fifth or whatever. You take a little bit of it. And again, it's up to you at your discretion if you're going to do it. That you take it, you put a little bit into a cup, a little bit. You ain't going to fill up the whole thing. And actually taste it probably. You know what I'm saying? You see that? So it's going into a cup there. And you actually put it in there. And again, this says 3 times a day. It's 50 or 500, 500 megagrams. But I usually just go by spoonfuls, right? Or about 1/5 of a teaspoon. And it's 3 times a day. But again, if you start to feel a little sick, you start to feel a little queasy, you get up and fall down or anything like that. I'm being a little bit extreme, but you know what I'm saying? If you feel bad, if you get a stomach ache, and this is probably the elderly, you know what I'm saying? This is more a lot of times for like the elderly, the ones that have the veins, the ones that have those problems that you're going to be, this is who you're going to give this to, right? So some of this stuff, the beet juice, I think, is the best, but I don't know if it's really considered that much of a herbal thing or not, but that's a good one for the blood. But again, what I want to do is go over these every week, and we can see what they are, what they do, and again, for information. It's something better than watching Harry Potter and all that nonsense, right? It's something, and this whole week has been about you. I know there's a lot of people, especially believers and people Hebrew roots, that are not dealing with their families, I guess I'd say. They're not, they're putting up trees, they're doing these things, they're doing those things. So this is for the family. This is for people that we, feel left out, feel like we can't wait until December 25th is over. Is it over yet? So, this is something for the believers and to understand and know and carry on through the week to help you carry on. Anybody want to taste? Don't taste bad. It's going to taste like dirt water. Not that bad, really. I've tasted worse. There's some herbs that got a really, really bad taste, and some of them's got a really gritty taste. Some of them's really hard to stir up. So again, you can make it like this, or you can get the roots of it. But the biggest thing is for doing, mainly for people getting up and down. But I want to taste it myself because I don't like people saying, well, you don't taste it, you don't have it. The whole point of this is we're buying it, we bought it, we got it. We'll taste a little taste of it and let you know. Some of this stuff we're trying with other people, to be honest. We're trying and, trying to see if it works. You don't know unless it works. So some of the things, obviously, you don't know until you have it. But once you have it, then you're in a worse boat in most cases. So if you're out there and you're trying any of these things, again, please let us know if you've tried it and if it worked for you. If it didn't, we can put that on here too. I'm all about honesty. I ain't about, again, I'm not selling it. I'm not promoting it. It ain't on my website. Ain't like I make a dime out of it. So I'm all in it for helping, particularly what it says, older people or people with inflammation. And hopefully that osteoporosis, the people that bend over, you see these there's a lady that walks through town and she's been over like that. But would she do this if we gave it to her, and would she take a whole bag? See, that's the thing about this is we almost need the studies like what they do, right? But when are we ever going to get studies like that? Because when you go and ask people, or you ask for volunteers, or you say, even if they get better, most people will just go on and live their life. Very few people that get better come back and say that helped me. Usually you never hear from them again. And that's in prayer as well. Hey, pray for me. My family's falling apart. And then you might see them a year or two later and you're like, well, I guess everything's fine. They're laughing and smiling. I guess they're better. They're still alive. So, so again, it's information. It's to let you know. So until next time, may Yahweh bless you. May his kindness shine upon you, and may he heal you. May he strengthen you. And may he grant you shalom. Shalom, everybody. Thank you very, very, very much for listening and for watching. Until next time, shalom and many, many blessings. And stay strong for all those out there, Hebrew roots in the way, all them non-Sunday church going people, and even Sunday church going people. But remember, this is for you, and this is your time to shine. This is what he's created you for, to be healed, to be healthy, and to help others. So until next time, Yahweh bless you. Shalom. Thank you very much for listening and for watching. Shalom. Blessings.